Hi, this is Brittany with BrownEyedGirlMom.com, and today I wanted to send out a video to you about getting a proper latch. So, most new moms go into breastfeeding thinking that this is just a natural thing and it's going to come very easily. And unfortunately, babies really don't know what they're doing. Instinctively, they know that they need to breastfeed, but there's a lot that they need to practice. So there are difficulties that arise, and if you're prepared for them, your breastfeeding journey is going to be a lot easier. So it's not just as simple as putting your breast there and baby's just going to latch on, and you're going to have a perfect experience. Some women really struggle and need to see a lactation consultant to get that help. And what I want to stress to anyone watching this is that if you do have problems, absolutely reach out to a lactation consultant either at the hospital that you delivered at or someone in your community, because they really have a wealth of knowledge of different tips and tricks that can be done. And there's only so many videos and books that you can read, but when someone sees you in person and can see what you're actually doing, they can help maneuver that baby so it's a very comfortable experience for both of you. And breastfeeding is so wonderful for both mom and baby that you really want to get this right. You want it to be comfortable, you want it to be easy, and you want it to be the best bonding experience for you and your baby. So first, I'm just going to tell you some basics on how to get started. So you always want to have something supportive for baby, whether it's a pillow. This is a pretty small pillow, but it's very firm. You can use a boppy pillow or a breast friend breastfeeding pillow. There's a lot of different, knockoffs of either of those two that you can use, but just something that's going to be supportive. When you're feeding a newborn, it's really important to keep baby as close to you as possible. As babies get older, they're able to control their body a little bit better, and they can find the breast a lot easier. So when you're holding your baby for the first time, you want to make sure that that baby is very close to you. So your baby's tummy is going to be right next to your tummy. So it's best if you have nothing on your top and baby has nothing on but a diaper. So this is skin to skin. And baby is going to feel the most comfortable being skin to skin. Babies are not used to being clothed right when they come out of the womb. They're used to your heartbeat, your smell, your sound, your the sense of you. So anytime they are near you, they're going to be more calm. Now, one thing to keep in mind is that you need to have baby be calm for feeding. So if baby is hysterically crying or very upset, you want to do just skin to skin kangaroo care first. So you just do that by keeping baby chest to chest and having a blanket over both of you. So this is going to calm baby. So yes, baby may fall asleep, and that's okay. So once baby is nice and calm and settled in and warm, because your body temperature actually changes based on what baby needs, you can slide baby down and baby should be ready to feed. So let's get back to that belly to belly. So baby is belly to belly. You want baby's body to be aligned, so straight across. That's why that pillow is so important. And you want to use your hands as support because babies have no control over their body. They're moving their hands constantly. Their hands are getting in the way. Parents are always trying to hold their hands, put mittens on them, swaddle them, keep those hands out of the way. This is actually not something that you should do. Babies use their hands. It's their only tool that they've had for the last 9 months that they can, put things in their mouth. They can suck on their fingers. They're so used to that they want to continue to do that. Birth is very traumatic for them as well as it is for us, and they need some time to adjust. So that's why most hospitals will not bathe a baby for at least 12 hours or until breastfeeding is better established. Because babies smell the amniotic fluid on their hands and it's familiar to them. So they're using their hands to try and feel around for the nipple, and it's actually a good thing. That's exactly what that baby is supposed to be doing. So yes, their hands are getting in the way, but try to be patient and let that baby find the nipple and latch on. So what you can do to support baby is use the palm of your hand, place it right between the shoulder blades of that baby, and you're just going to hold baby right behind the ears. So the reason for this is you can control baby's head and support his shoulders, but you're not pushing on the head. So when you push on a baby's head like this or hold baby like this and expect them to feed, what they're normally going to do is push their head back. So when you hold like this, you're able to control them and you're able to have a free hand to hold your breast. So this is my breast here. So this is a very small breast, obviously, and a very small nipple. You know, breasts and nipples come in every single shape, color, size. So this is just going to be used as an example. But what you really want is, depending on which way baby's mouth is going. So this right here is called a cross cradle hold, and it's because baby is across my body and I'm holding on to him. I'll show it to her. So her mouth is going vertical. So you want to make a U with your hand under your breast. Now, if you have small breasts, that's fine. You don't need hardly anything to get a baby to breastfeed. That's not the point. Bigger breasted women do not breastfeed better than small breasted women. So do not be worried about your anatomy. If you are concerned about your nipple, see a lactation consultant. That's what we're here for. We're here to help you. So you're going to make a sandwich with this. And what I mean by that is you're just going to compress the breast because you want baby to get as much breast tissue in her mouth as possible. So this allows for her to latch on and draw in more breast tissue because your milk glands are back here. So many moms try to just put the nipple in, and that's going to cause you pain. That's not where the milk is coming from. The milk is coming from your glands back here. So yes, baby will get some milk there, but it's not adequate milk transfer and it's going to hurt. It's going to feel like chomping and pinching. So what you want to do is touch your baby's chin to your breast first. Stroke your nipple from his nose down to his bottom lip. So this is instinctively going to make baby open his mouth pretty wide. And once that happens, you want to use your supporting hand, palm between the shoulder blades, and push baby into the breast. So if you can see that. So you push baby into the breast. And you want baby to get more breast tissue from underneath. So a good rule of thumb that you can do is to kind of put your thumb to point your nipple towards the roof of the mouth, because babies will not stay on and suck if they don't have good nipple placement. If you take your tongue and feel the roof of your mouth, when your hard palate starts to meet your soft palate where it goes up, that's actually where the nipple should be. So that's free space when the baby is sucking, and that should not be causing any pain. If you're feeling that pinching or chomping, that means that baby is just on the nipple and is chomping down on your nipple. So what you need to do is break that seal. So you take your pinky finger, put it in the corner of baby's mouth to break the seal, and slide your nipple out. Try again. You want to get baby off to a good start of nice deep latches so you can have a pain-free journey and a very long, successful journey. If baby is only getting the milk that's right at that nipple tip, he's not going to continue to gain weight and your milk supply is not going to be enough. So you have baby here and baby is latched well and it's comfortable. So what baby should be doing is a lot of sucking. So you just have colostrum to start, and then your full milk will come in around day 3 to 5 postpartum. So you're most likely out of the hospital and at home by then. You should start to feel more full. But right at first, babies will suck really fast, and then you might hear a swallow, or they might pause. They may fall asleep for a little bit, and then they wake up again and start sucking. So if you have a baby that's very sleepy, or a baby that's sleeping for more than 5 minutes at their little pauses, you want to keep them engaged. Stroke baby's head, have somebody tickle his feet, talk to baby, sing to baby. You can compress your breast to get a little bit more milk in there to kind of remind baby what he's there for. And believe me, your baby will understand in due time what is coming out of that breast and that he wants it all the time. So the struggles of getting a good latch on are short. So in the length of time that you are most likely going to be breastfeeding, once you get this down, it does get a lot easier. You just have to remember to have a lot of patience, have a support person that's going to be there for you when you feel like giving up and giving formula, and have somebody that you can call. Find a lactation consultant, save their number, call them and ask questions over the phone. A lot of hospitals right now are not seeing outpatients because of COVID, but hopefully that does change in the very near future. And there are also some lactation consultants that will come to your house. So you just have to find what's going to work best for you. So you want to monitor the time that you're starting breastfeeding, and you're going to go from about 2 to 3 hours based on what time you started. So most babies will show some hunger cues. They'll start wrestling around. They'll start smacking their lips, sucking on their fingers. Those are hunger cues that you will learn from your baby in the first, hopefully 24 hours if you're doing rooming in. So babies do need to be burped, even though they're only getting colostrum right now. It's a good habit to get into, and sometimes they can swallow air when they're latching on there. So babies should feed for about 15 minutes, and once they are nice and sleepy and it doesn't seem like they're sucking anymore, what you can do is burp them, put them on the other side, and see if they are going to take any from that breast. So some things that you want to look for when you are getting baby latched. So number one is comfort, but you also want to make sure that baby's lips are flanged out. So sometimes babies will suck in their bottom lip, and that will cause a lot of pain. So you can check to see that your baby's lips are flanged. So what it should look like is, like, these are the lips. That's the mouth. So baby should have lips outward, kind of like a duck, and you should feel a nice tugging pull of that nipple going into the baby's mouth. Baby will have some milk on his tongue, or you may have some around your nipple when baby comes off. That is a good sign. You can hand express to make sure that you are getting colostrum. You can have a lactation consultant show you how to hand express, and I do have another video on that and some information on my blog of browneyedgirlmom.com. So please feel free to take a look at those. If you have any questions or any concerns, definitely reach out to a lactation consultant. Just remember to keep baby skin to skin as much as possible in the first few days to really get them in the mood for breastfeeding. Practice makes perfect. The more that you do it, the better that baby is going to do, the more confident you're going to feel. Try to make sure that you're using a position that's comfortable for you. Babies have no idea what they're doing. They don't know that there's different positions out there, but you do. So they're always going to adapt to whatever is comfortable for you. Make sure you're sitting in something that's comfortable. So right now I'm in an office chair, not the best for breastfeeding, but if you have a rocking chair or the couch or the bed, you want to try out these different things because you're going to be feeding in all of those places. Make sure you have something set up like water and snacks or anything that you'll need for breastfeeding in those areas. Diapers for sure, especially for in the middle of the night. You want to change diaper first and then feed the baby so baby's nice and sleepy and put baby back in the bassinet. So this is cross cradle, just one example, and I have a lot of different positions on my blog that explain what they are. This is easiest for moms who have breastfed before or a little bit older babies. What I do recommend for new moms is actually the football hold, and I can show you how to do that real quick. So you're going to use a pillow on the side of you, or the boppy or whatever is most comfortable for you. So you're going to hold baby. Baby's feet are going to go behind you. Baby is going to hug your breast. So you don't want hands in the way because baby's not going to get close enough to you. So if I have baby's hand down here, I can't get that baby close enough to me. But if baby is hugging my breast, yes, hands are going to get in the way, and that's totally fine. But you're going to do the same thing, palm between the shoulder blades, thumb and forefinger behind the ears so you have control. You're going to hold your breast with the other hand. Some babies don't need you to hold your breast, but others babies do, and you may have to hold it through the whole feeding. So with this way, you're going to make a C instead of the U like we were making before because baby's mouth is horizontal now. So you want to make that sandwich like this. One important thing that I forgot to mention before, make sure your fingers are out of the way because if your fingers are up here and you're trying to get that baby to get a deep latch, he can't go past your fingers. So get your fingers out of the way. If you have smaller breasts and you can't do that, then go like this. Just use your thumb on the top to point your nipple towards the roof of the baby's mouth and keep nothing down here. And then you're just going to stroke that baby from nose to bottom lip. Make sure he opens his mouth nice and wide. It's a very split second and it takes practice. But once that baby opens his mouth wide, you're going to push on the back of the shoulders, bring that baby nice and deep into your chest. Remember, Baby comes to you. You do not come to baby. If you feed your baby like this 8 to 12 times in a 24-hour period, your back is going to hurt. Bring baby to you. That's why it's so important to have support pillows. Something that's going to keep that weight up, because even though your baby may only be 7 pounds now, that's not going to last forever. Babies grow super, super fast, and your arms are going to hurt, your back is going to hurt. Don't add to the list. Make this as easy as possible. So once you do that, if baby is able to hold the breast in his mouth, that's fine. If he can't, then just make sure that you're still holding on to that. This way you have another hand to do whatever you want, because you're going to feel like you're feeding constantly, because you are. But again, this is a temporary time period. You're going to look back and it goes by very, very fast. So just remember, the more you practice, the better you're going to be skin to skin, and make sure you have a proper latch and you are hearing some swallows in there. If you do have any pain, please do not hesitate to reach out to a lactation consultant. I welcome any questions that you have for me. I try to respond as fast as possible and to all of them, but know that your hospital that you delivered at should have a lactation consultant that you can talk to. So check out my blog for more information, browneyedgirlmom.com. I'm also on Facebook, Instagram, and Pinterest. So I hope to hear from you, and happy breastfeeding.